Dr. Fickenshire says that you should do this or that. To an information democracy. You know, Dr. Fickenshire, I was out on the web last night and I looked up your website and I noticed that, gee, Dr. Fickenshire, you're not in the upper two-thirds of physicians. Matter of fact, Dr. Fickenshire, is it true that you're in the bottom quartile of all physicians that provide this service? Oh, you're in the bottom 10%. Gee, Dr. Fickenshire, I'm not sure I want to use you anymore. That's information democracy. And that's happening. When I talk with my physician colleagues, the number of people that are coming in with information that they've examined and that they have poured over and that they know about is absolutely incredible. I'll share an experience with you. I'm a Kaiser patient. I had a back procedure back in November. And as I was being wheeled into the OR, my orthopedic surgeon says, oh, by the way, we discovered that you have some macroscopic hematuria. And I was, macroscopic hematuria? What are you talking about? Well, that's okay. We'll put you to sleep. We'll take care of it later. I was impressed with the service. This is actually a good story. So I went out and I found out, and we did a whole workup and discovered that I had bladder cancer. Now, when my surgeon called me and said, Kevin, you've got bladder cancer, you can imagine the emotions that I suddenly had as a male, because bladder cancer is a real problem for men. So I went to my urologist and had a cysto, and then I had surgery, diagnosed me with stage 1. Whew, stage 1. Thank God. And I can tell you that when that happened, I became an expert on bladder cancer in about 24 hours. I looked up not only did I go to the web, I went to the National Library of Medicine. Because I'm a physician, I know exactly where to go. I got the latest studies. I knew, I was in tears in my house. And yet at the same time, I discovered that stage 1 is not that bad. As a matter of fact, my urologist, he has sort of a bizarre sense of humor. I have to go see him once a quarter where he does an office cysto, and he says, you know, you're going to get to enjoy this over the next couple of years. I just had my third one. I'm clean, and I didn't enjoy it, you know, all that much. But that's what's happening to people. Is that literally they are able to get access to information immediately and literally within 24 hours. Even though I hadn't really thought about bladder cancer for a long, long time, I had become a consumer expert in that particular problem. So information democracy is becoming very, very important.